The increasing incidence of bloodborne diseases such as AIDS are creating change in our society. Precautions must be taken in a service industry that comes in contact with a multitude of people daily, even though the chances of contracting a bloodborne disease are very slim. Because of its lethal nature, it is important that you understand how the diseases can be transmitted and the proper protective measures to follow. In this program, you will learn what are bloodborne diseases, how they could be transmitted in the work environment, and protective measures you can take to prevent exposure. Bloodborne pathogens are microorganisms in the bloodstream that cause disease. They are found in blood and other bodily fluids, such as semen, vaginal secretions, and breast milk. Although there are many types of bloodborne diseases, the most prevalent in our society are hepatitis B and HIV. An inflammation of the liver occurs with hepatitis B. Symptoms of the disease include nausea, dark urine, jaundice, and exhaustion. About 1/3 of those who have the disease show no symptoms, but are carriers with potential to pass the disease to someone else. The HIV virus progresses into AIDS, initially developing flu-like conditions such as chronic fatigue and fevers. The virus attacks the body's immune system, making the patient susceptible to many types of diseases, including forms of cancer and pneumonia. Hepatitis B has a much higher concentration of viruses per milliliter of blood than HIV. Therefore, it is more contagious, even though it is less publicized. For example, the risk of acquiring hepatitis B from a needle stick contaminated with hepatitis B blood is 6 to 30%. Acquiring HIV from a needle stick contaminated with HIV is less than 1%. Hepatitis B can be prevented with a vaccination. Bloodborne diseases can only be transmitted when there is a direct route of entry into the bloodstream which contaminated blood could enter. This includes breaks in the skin, such as a cut, scrape, dermatitis, or acne, splashes into body openings, such as the eyes, mouth, and nose, or penetration into the skin by a sharp contaminated object. In which of these situations could a bloodborne disease be contracted? Is this a means of exposure? Is this person properly protected? Could this person be exposed? You should always use universal precautions. This means you should assume that all blood and potentially infectious substances are in fact infectious. In the first scenario, there was a potential infection because the source blood that was on the glass penetrated directly into the skin. Never pick up broken glass with your bare hands or with gloves that are not cut-proof. Use a broom and dustpan or even tongs. If a fellow employee is injured, contact the proper personnel immediately. Comfort the person, but avoid contact with blood. In the second scenario, there was no exposure because the housekeeper was wearing protective gloves. Wearing gloves is an essential safe work practice when there is a potential exposure situation. In the last scenario, exposure could have occurred from a needle stick injury. Puncture-proof sharps containers should be available for proper disposal of sharps. Never assume they will be disposed of properly. Never reach into the trash. The fear of contracting AIDS has caused many misconceptions of the disease. HIV is not transmitted by casual skin contact. It cannot be spread by the sharing of food, drinking glasses, or towels. It is not transmitted by coughing or sneezing. Tears, perspiration, and saliva can carry small traces of HIV, but not enough to be transmitted. The HIV virus cannot be spread by insects or animals. The situations in which exposure could occur can be eliminated by following safe work practices. This includes good housekeeping procedures, personal hygiene, and the use of proper protective equipment. Protective equipment acts as a barrier between infectious substances and potential routes of entry. Gloves must be worn when there could be any contact with blood or other infectious material. Before putting on gloves, check for holes, tears, or punctures. Hands must be washed immediately after removing gloves. Never wash or decontaminate disposable gloves for reuse. Blood spills or other potentially infectious material must be cleaned up immediately. When cleaning up a spill, wear full personal protective equipment to prevent infectious material from contacting any part of your body. A 10-to-1 mixture of water with normal household bleach will effectively decontaminate the area. Make sure the cleaning is thorough. If an exposure occurs, immediately wash out the potentially infected area. Then report the incident to the proper personnel. All medical records will be confidential. Understand situations in the work environment in which exposure could occur. Eliminate contact with blood or other potentially infectious material by wearing protective gloves and following safe work practices. Use universal precautions. By understanding bloodborne pathogens, you can achieve a balance between overreacting and being careless. By following safe work practices, you can prevent occupational exposure to bloodborne pathogens.